Breast lift surgery, also known as mastopexy, is a procedure designed to lift and reshape sagging breasts, making them perkier and more youthful. Now, people often confuse it with breast augmentation, but a breast lift is a completely different procedure. The breast lift procedure, this includes the removal of extra skin and rearranging the breast tissue so as to raise it and give a natural contoured look, give an upper pole fullness. Whereas breast augmentation, this includes either inserting implants or doing a fat grafting to increase the size of your breasts. Now let me explain breast lift in 6 simple steps so that you can make an informed decision before opting for the procedure.
I played it innocent, a feel of discontent. I'm finally facing it all, fearless.
Breast lift surgery is usually performed under general anesthesia, and a board certified surgeon will have a complete team including a board certified anesthetist to take care of the right dosage while managing any potential risks. Now coming to incisions, these are typically made around the areola and down to the breast crease. It can be either a lollipop shaped incision or an inverted T shaped incision. The size and location, this depends on the extra sagging skin and the size of breast we are working on. I have a detailed reel video explaining the different kinds of incisions whenever we are doing a breast lift procedure. Be sure to check the link in the description. Now, once the incision is made, the underlying breast tissue is divided into 2 halves and the lower half is lifted up and fixed under the upper half to give a good fullness to the entire breast, and the extra skin is removed to give a firmness to the breast. Now, usually whenever a breast has sagged, the nipple also sags along with it, and sometimes there is also an enlargement of the areola size. So whenever we are doing a breast lift, the nipple, it is repositioned higher on the breast on the most prominent position of the breast mound, and the extra areolar skin is also excised. The size of the areola is reduced based on the patient's expectations. Like I already said, the extra skin is also excised. Now whenever the breast sags, the skin and breast tissue, both of them, they are dragged down. Skin being the envelope, that also enlarges in size, and that is why we need to excise this extra skin and tighten it to create a more lifted and youthful breast shape. After all of this, the incisions are closed in multiple layers with sutures which are absorbable, and the breast is then wrapped into bandages, and then later on, once the bandages are removed, patient is made to wear a surgical bra. So breast lift surgery, it can take anywhere between 2 to 4 hours depending on the extent of the procedure, the amount of sagging. After the surgery, you will be monitored in the recovery room before being discharged, which is on the same evening. You will need to be wearing a compression garment for at least 6 weeks after the surgery. Avoid strenuous activities involving the pectoral muscles, and you can do the light workouts or light exercises within a week's time period. Now, like any other surgery, there are a few potential risks associated with breast lift surgery as well, like fluid retention, surgical wound infection, blood clot formation or hematoma, loss of nipple sensation or tingling sensation in the areola, which is called paresthesia. A board certified surgeon with credible experience will use advanced techniques and his or her experience to avoid such risks as necessary. Be sure to do your due diligence before choosing the right surgeon. Have more queries? Feel free to DM me on my social handles linked in the description. Signing off for now. Bye bye. Take care.